I'm Dr. Corey Campbell, Motion Palpation Institute. I'm going to give a brief description, kind of an outline of what the lower integration class involves for the Motion Palpation Institute. Basically, what this class is it is a combination of palpation and adjusting that will cover from the thoracolumbar spine to the pelvis to the knee to the foot and ankle. And so a good way of thinking about it is it's a combination of the gait class and the disc class all kind of intertwined. And so basic outline, the way we typically start is we start with the thoracolumbar spine. We talk about palpation of that area. We talk about adjusting of that area, and then we go into respiration and core stabilization for the lumbar spine. And so we'll cover some of those techniques, and then we go to the foot and ankle. So we'll talk about adjusting and palpation of the foot and ankle and the lower extremity, and then we'll go into some of the other case management things that would involve the foot and ankle, plantar fasciitis, Achilles tendinosis, and what you would do from a soft tissue standpoint, what you would do from a treatment standpoint, and then also the screening and the assessment. So we go through the functional assessments of those areas. So we go through gait analysis, what you do with the running athlete, how you would analyze running gait, 6-inch step down, and then the functional hallucis limitus testing and all of those things. So we go through all of that, and then we kind of put a bow on each section by going through the clinical case management. Then we'll go up into the pelvis, and we talk about the disc and how to assess for disc-related injuries, talk about how to palpate and adjust the pelvis. We would tie in some of the things that we did in the thoracolumbar spine as far as lumbar spine stabilization and the testing that we would do with that. And then we kind of move into some of the other things of the hip. We finish typically with the hip and knee on the second day, so we go through hip assessment, internal hip rotation testing, 6-inch step downs, hip abduction test, internal hip rotation, hip extension testing. We go through all of that, palpation and adjusting of the hip, and then the soft tissue considerations and the rehab of that area that would also tie into some of the clinical case management things such as IT band syndrome, hip bursitis, trochanteric bursitis, and those kinds of things, and how you would manage those things clinically. So that's a basic overview of what the integration class is. It's a combination of all the best of motion palpation in that you get a lot of palpation and adjusting, and then we combine the functional assessment along with the treatment options that would come from that functional assessment that would include soft tissue and functional rehabilitation or functional stabilization. So that's an overview for the lower integration class that the Motion Palpation Institute presents. Thank you.